Karen Jones, I'm a senior pharmacist at the All Wales Therapeutics and Toxicology Centre. And you'll probably know Sabrina, who usually does this section, and she's at the Bevan Commission today, doing lots of work there. So I'll stand in for her today. So yeah, we've been had a really busy few months. So firstly, I'll update the group on some work that we've done to engage with patients and patient organisations. So we had some staff attend the Eisteddfod in May, and they really enjoyed meeting people and hearing their ideas and suggestions for medicines use in Wales. And there's a particular theme of helping make medicine safer. We're delighted that we attended the 10 of us All Wales Cancer Community Summer event at the Senedd to hear about how they support people with cancer in Wales, and for us to highlight how the patient voice is an integral part of the work we do. Other work that's been going on, so we're currently working on their new AWMSG strategy. So this is currently in development, with sessions being held with the AWMSG members, including lay representation, to shape the next steps for the group's aims and objectives. So there will of course be opportunity to input, and we'll welcome suggestions of representatives about what's important for patients and the public in Wales regarding access to medicines and how we use medicines. AWTTC has also been working hard to adapt its methods and processes for assessing health technology appraisals to ensure that we're putting our efforts where they're most needed and looking at medicines with the greatest clinical needs, and to ensure that we have continued equity of access in a changing landscape. So key changes including removing the end-of-life modifier and introducing a new severity modifier. And if you're interested in more information, the policy is up on the website. So this is the policy for appraising medicines for severe conditions. We held our third Learning at Lunch session. So this is for clinicians and healthcare professionals with a focus on education, and it includes students as well. So it's a really popular online session where we can promote our work, and it includes talks on common skin infections, repeats prescribing in GPs, surgeries, and primary care antimicrobial guidelines. And we were also delighted to have the Yellow Card Centre Wales Medicine Safety Day in June. So this event was held jointly with AWTTC, and it celebrated the 40th anniversary of the YCC in Wales. So the programme featured a huge variety of presentations, from what happens to your yellow card and the future of pharmacovigilance, and also includes medical devices. So other news in terms of our AWMSG work. So Welsh Government has approved advice from the AWMSG recommendations for a new medicine, and in June the All Wales Paediatric Asthma Management and Prescribing Guidelines, which have been developed as part of an integrated approach to standardised care across Wales for children with respiratory disease, were approved. So this has been achieved through a lot of collaborative work between the Welsh Paediatric Respiratory Network and representatives from all hospitals in Wales and the Respiratory Health Implementation Group. In May, a leaflet to provide guidance for improving the management of unlicensed kind of special medicines and off-label medicines in all sectors of healthcare in NHS Wales was endorsed for patients and carers. And this is, we might be talking about this later as well. Last week, we presented at the Medi Wales Connect conference, and this focused on innovation through collaboration, and featured lots of third sector and patient groups as well. And this week, we've been at the Bevan Commission conference, which is titled The Tipping Point and Where Next for Health and Care. So I was there yesterday, and it was really interesting. There's a large focus on the good work that's been done by the NHS in tough times, and how working with patients is going to be key to ensuring the future of an equitable service. So lots of food for thought from that one, and wondering if anyone else was there. So there was also a minor update to the primary care antimicrobial guidelines recently. And a dashboard, sorry, it's a lot, very busy. A dashboard has also been developed to report on progress in reducing the carbon footprint of inhalers used within primary care in Wales, and also reports on the progress for increasing the interval of prescribing durations for prescriptions issued within primary care. There's currently a bit of concern about antipsychotic medications and ensuring that they're used appropriately and safely. So the use of a comprehensive person-centred assessment tool to support the prescribing of these medicines has been recommended. So the adverse drug reaction profile has been developed by researchers in Swansea University to identify adverse reaction. And it's been proven to reduce the use of antipsychotic medicines and has been acknowledged by the All Wales Medicine Strategy Group. And lastly, the Welsh National Poisons Unit, part of the National Poisons Information Service, was represented by quite a few of our staff at the Congress for the European Association of Poison Centres and Clinical Toxicologists, two of whom gave oral presentations on inadvertent installation of electronic cigarette liquid into the eyes and on sodium nitrate as an emerging public health concern in the UK. And the Poisons Unit also recently attended the British Toxicology Society Annual Congress in Birmingham. So I think that's it from me. Lots of work. But yeah,